Oh, I didn't even realize you can see the fan in there.
Kinda tired trying at the same shit. Kinda tired trying to give a fuck. Saving grace has never hit the same end. I've been running out of luck, yeah. Said I've been running out of luck, yeah. Said I've been running out of luck, yeah. Said I've been running out of luck, yeah. Yeah, yeah, yeah. Kinda tired trying at the same shit. Kinda tired trying to give a fuck. Saving grace has never hit the same end. I've been running out of luck, yeah. Said I've been running out of luck, yeah. Said I've been running out of luck, yeah. Said I've been running out of luck, yeah. Yeah, yeah, yeah.
There's a way for me to set an event on TikTok. Do they do that?
Kinda
Or is that
tired
just an
trying
old
at
lady
the same
Facebook thing?
shit. Kinda tired
Oh,
trying
it's
to give
just
a
an event?
fuck.
Okay. Get people in
Saving
here.
grace has never hit the same
For fuck's
end.
sakes.
I've been
Fuck's
running out
sake.
of luck, yeah. Said I've been running out of luck, yeah. Said I've been running out of luck, yeah. Said I've been running out of luck, yeah. Yeah, yeah, yeah.
Have it.
Yeah, I could have done that a little better, but it was hard by myself.
It's cool. Look at TikTok. We're just talking about some mental health, sleep, and menopause, sexual menopause. Salute. Welcome back to the Fuck Stakes with Dr. Cari.
Hey guys.
Another amazing Sunday to podcast.
Oh, beautiful Sunday, sunshiny, crisp fall day. Loving it. It's my favorite time of year.
Jeffrey's in the cut. Jeffrey's not feeling well this week.
Jeff is down and out, and we didn't want it.
Thank God he helped us get this together tonight.
Yes, appreciate you,
Awesome.
Jeffrey.
My family's out of town.
I know you are in Phoenix.
Yeah, my kids got to go to the WNBA game.
You didn't go?
No, I had shit to do. I had work to do.
I mean, I got the picture. I just assumed you were down there.
Heck no.
Oh, it's fall break, isn't it?
It's a girls' trip. So it's got Amaya and Mary and Lindsay, my wife, the kids, the girls. They're all in Phoenix right now, having a great time.
All right.
What are we talking tonight?
You wanted to talk about menopause and how it relates to mental health and sleep and sexual appetite.
I also want to get into just mental health. I just want to go across a couple of mental health things, like in general. Like, I feel like as you get older, the traumas of maybe like your youth, it start to weigh on you as a, you know. And for me, like the more successful I get, the more things that I get accomplished, the more fearful I become sometimes.
Well, that's interesting.
Oh, for sure. When great things happen to me, panic attacks happen to me. You have panic attacks?
I do not. I've seen plenty of them in my friends and family and patients, but I haven't had one myself. Probably good since I'm an emergency physician. That would be a super bad combination.
I just think that as you, like I said, as you get older, when more responsibility is placed on you, it's like, holy shit, the world's on my shoulders. How do you deal with mental health in general?
I get a lot of therapy. Sometimes I have to go on antidepressants, either for chronic pain or depression. I have seasonal affective disorder. So after August 21st, when we start tipping away from the sunshine up here, my mood takes a major dive. So I'm always on alert about this time of year. And then right around Christmas, I don't think it has anything to do with the holidays, but it's been dark for a long time and the days have been short for a long time. And I think my brain just runs out of serotonin. So somewhere between like Christmas and New Year's, sometimes I wake up and all of a sudden I weigh like 814 pounds. Like do you ever feel like that?
No.
Oh my God. It's amazing. Like I go to bed at whatever I weigh, 180 or whatever it is. And I wake up and I'm just like, somebody just packed me in wet concrete. All my thoughts, all my physical movements just weigh so much more. It's crazy. And that's when it's like, those are like the physical manifestations of depression for me.
Let's talk about depression.
Yeah. So depression tends to be a lack of serotonin and norepinephrine. And so those are the two neurotransmitters that you need for your happy juice and to feel content and for energy. And so this is a disease just like hypertension, diabetes, cancer, anything else. Yeah, it's your body is not acting right. And it's either because you're not producing enough of it in your brain and in your guts, or your receptors aren't receiving it. And so like either the mail carrier doesn't have your letter or you don't have a mailbox to receive it.
Now, did that come where you always have depression issues, or did that come with later on in life and menopause and the whole nine?
Oh no, it started, I think I had my first depressive episode my first year of medical school, but I had two like extraordinary bouts of insomnia during college. We're talking like I did not sleep for more than 20 minutes at a time for like 2 weeks in a row. Like none, zero. Like I couldn't figure out how to make myself a bowl of cereal. One morning I had like the bowl out. I had cereal, milk, juice, and I had put the cereal in the bowl, and then I was trying to pour juice into the spoon. And it was like, wait a minute, what's happening? Yeah, I was a menace to myself. But boy, I will tell you, my basketball skills were amazing. And I think it was just all muscle memory, right? As a veteran, I will tell you mental health is important, and I was lucky. Yeah. There's so much to be had there. And I think, when you're talking about the accumulation of your experiences through your life and that causing weight on your mind and causing anxiety and depression, that's absolutely real. And if you don't get the therapy to start unraveling that, and basically you can't get rid of it. Like your experiences are what they are, right? And they make you who you are, and you should be thankful for that. But if it's something that's interrupting how you function, then you can use therapy and DBT and EMDR and like all of the acronyms that the therapists and psychologists use to just dial that down so it's not so intrusive, so that it's not so spicy. It's like a jalapeno instead of a ghost pepper.
Now, if you're taking medication and you're going to a therapist, how does that therapist talk you off the ledge of depression?
You basically talk about what's causing that, and
comforting is just a continuous comforting and reassurance that you're okay.
Some of it is reassurance. And I mean, lots of different therapists, you got to find the one for you. Like if you're seeing a therapist and you leave there in worse shape than you go in, or you're irritated or angry, keep shopping. Like this is like wearing a bad pair of shoes. You need to find a comfy pair, and your shoes are fucking weird looking and you said they're uncomfortable. So you need to throw those things in the trash. But same thing for a therapist. Like don't keep wearing uncomfortable shoes. Keep shopping. But like my therapist, she knows that I'm very scientific. And so we talk about the science and the physiology of it to kind of keep me squared away. So I don't feel like it's like an emotional failing. Like I'm not enough or I'm broken, because that's the way you usually feel when your mental health is in the toilet, that you're broken, that you've done something wrong, that you're failing at life, when we should treat it like hypertension. Like, you can't control your blood pressure, so you take medications for it, or you eat better, or you exercise, or whatever. So she gives me homework to do, whether it's moving my body, talking to myself better, writing things down so that they make better sense. And then she's done some EMDR with me when things are really bad. And so we go through visualization.
What is EMDR?
Oh, eye movement. I can't remember what the DR stands
Paging
for.
Dr. Cari, paging
I know.
Dr. Cari.
I'm not a therapist, so I don't have to keep this in my mind. But it's basically re-channeling your neural system through eye movements while you visualize your happy place. And so she sets me up for, where's my happy place? Like, what does it feel like? What does it smell like? What does it look like? What are you listening to? All of these things. So like really, really honing in on where your happy place is. And then with that as the safe place, then she takes me into like, what is upsetting me? What is causing anxiety, panic, depression, whatever. And then you use a series of tapping. And so you can use a clicker that she can use if you're seeing people in person, or if you're remote, you can tap yourself. And you're basically trying to redirect your brain towards knowing that even though you're going down this really scary, awful, terrifying road, this happy place is available for you. And so it's not hypnosis. You're not getting rid of your memories or anything like that. It's actually channeling your energies and your brain to be like, remember that everything's going to be okay. And it just turns it down, you know? So instead of walking around with this anxiety about something that's like an 8 out of 10 that's disrupting your life, then it's like a 4. You know, it's there. You notice it, but you don't have to focus on it. You can get past it.
How much do you recommend that we have a therapist?
Oh, I think anyone with an IQ over 97 should probably have a therapist.
Should.
Like, if you're smart enough to be kind of a success-driven, goal-oriented person who wants to achieve things, you've probably been through some shit. And you should probably untangle that because it's literally like, you know, ropes around your legs. You can move a lot easier. You can go a lot farther if your therapist takes you through the things that you've been through and makes it smoother, you know, takes the weight off, untangles the knots.
So how does the medication help you?
Well, oftentimes they have to go hand in hand, right? Because just because you go to the therapist doesn't mean that your serotonin gets boosted. It doesn't mean that your dopamine is under control. And so you might have to take some medications in addition to that to really get your mental health squared away. And again, like I have told countless patients, and I continue to try to convince myself, going on those medications is not a moral failing. You're literally just taking your antihypertensive to get things under control. And if you have to stay on it forever.
That's what I was going to ask. Do you stay on it, or are you on it when you go through those emotions?
Well, okay. So this was the other thing. There's situational anxiety and depression where nothing's wrong with your long-term neurotransmitters. You're producing as many as you're supposed to. Your receptors are working, but you are working under like a super toxic supervisor, or you are in a just horrendous, poisonous relationship. Something's going on with your kids or your parents. So there's a situation that is causing you to feel sad, unmotivated, anxious, things like that. That's different. Medications are not necessarily going to help with that. Right? It takes 3 to 6 weeks for the medications to actually kick in and help you with your neurotransmitters. So that's not something that you're going to take because you had a bad day or you had a bad week. And so medications are for long-term chronic depression, anxiety, which is interfering with your life for more than, a couple months, because it's going to take that long for you to turn it around.
How do you push through though in front of people when you're going through this shit? How do you, you put on the poker face or what?
Sometimes it's a fake it till you make it, which is good for mental health and orgasms and professions and all sorts of things. You knew I was going to have to bring it up at some point. You weren't going to not talk about orgasms today.
Okay.
Yeah, sometimes it's fake it till you make it. Sometimes you just have to put it on the back burner and get shit done, as we all do, and just power through. But I really encourage people to talk to your loved ones that you feel safe and secure with about what you're going through, because they're going to help you. And not only do you benefit from that, they benefit from that. Because if you're one of those people who like everybody comes to you for all the things, you're the rock, you're the savior, you're the go-getter and all that. If your friends can help you, they're like, oh my gosh, yeah, I'm giving back. And you know how that feels when somebody comes to you and they're like, hey, I need something from you. And you're like, I totally got you. I got this. It's a mutual benefit for sure. And so I don't think it's one of those things that should be shameful. You should be embarrassed, because you also don't know how that might be received. And people are like, oh my God, me too. And I've never told anybody. You might have just saved their lives in a way. So
find common ground with people that feel the same. Okay.
The women's retreat. Yes.
Yes. Women's retreat.
That's
Got that coming up very soon. Women's retreat.
That's right. So I'm going to be the keynote speaker at a women's wellness and health retreat. It's going to be October 25th here in Reno. And I'm the keynote speaker, so I get everything hyped. And then we're having talks on gut health and nutrition and mindfulness and mindset and hormones. And then the afternoon is going to be a sound bath, and you can get IV hydration, and all sorts of good things can be happening. And it's basically about helping you to have a better quality of life so you can be successful. And yes, it's a women's wellness retreat, but like, buy a ticket. Doesn't matter what your genitals are.
Listen, me and Jeffrey gonna be here background strippers.
Yeah.
Okay, both of us, thonged out, oiled up. Me and Jeffrey. It's a done deal. My wife said it's okay.
Oh my God. So also bring a blindfold in case that's not really your thing.
Why blindfold?
I don't know that I want to see that.
Saw you naked.
I was not naked.
Reporting your situation. I'm your teammate.
That's true. I'll support you in your thought. Will you wear my red sequined
I will not.
undies?
Now you're pushing it. And none of this getting into sequence undies. Anywho, I want to get into menopause specifically as mental health. What goes downhill at that point? Like,
oh, hold on. Our camera is going crazy.
I thought that was Jeffrey playing around the background.
No, I think I need to fix it. Hold
Okay.
on. Hold on.
I'm going to keep asking the question while you work on this.
Yes.
Like, I know that I have a friend currently who is dealing with some mental health issues. I mean, dealing with some menopause issues, and she's forgetting things, not feeling so sure of herself. Just a lot of uncertainty going into menopause, and a lot of denial as well about menopause. How does it start to affect you mentally going into menopause?
I will be right with you.
Take your time. We got some technical difficulties. We'll be all right. So with the TikTok, thanks for joining Dr. C for fuck's sakes. You can chime into Dr. Cari's telehealth.
That's right. If you need help with this stuff, you can get in touch with me.
I don't know where I can find you.
I did. It was off, but now I don't know. It has a mind of its own. I can't help it.
Okay.
So yeah, with menopause, estrogen and progesterone and testosterone all help with your moods. And so as your ovaries are getting tired of life and they're not producing those hormones the way they should or in the right percentages, then that can really throw off your mood itself. And then you add to that the fact that those hormones are also in charge of sleep and your sleep cycles. And so during perimenopause, you start not sleeping very well, and you're not cycling the way you should at night because you're not cycling very well during the day either. And so now you're an insomniac, and now your estrogen is going crazy as well, and your serotonin and dopamine go nuts. And so you can't possibly have a good mood or good tracking and concentration. That's where the brain fog comes in. It's both because you're not getting the estrogen and testosterone that you need, and the fact that you're not sleeping well. And we know when we're irritable, and that doesn't feel good. And so that makes us more irritable. Like, it's just, you get into this wicked cycle where nothing seems to be working well, and you're not sleeping. You don't feel good. You know, you're acting like a turd, and it just perpetuates itself. And so your quality of life goes in the toilet, and frankly, everyone around you gets to suffer with you.
What are some of the most common things that happen when you mentally, when you go through menopause?
Anxiety is big because estrogen is a huge part of that. And again, the insomnia. So progesterone is actually this like calming down medication and hormone. And so when I prescribe that, I give it to people to take at night. And it's like a natural sedative without making you feel groggy. And it actually helps you do the sleep cycle. So we have non-REM and REM sleep cycles that take about 90 minutes to go through. And you need about 4 to 6 of those a night in order for your brain to do all the restorative work that it does. Mm-hmm. And while you're asleep, like, it is basically your executive assistant is putting all of the things in the filing cabinets while you're asleep. And so you're making short and long-term memories in there, and you are filing experiences away and new skills. Like, if you learn something during the day, at night is really when you put that to work and put it in its categories in the filing cabinet, right? And so if you are not getting those 4 to 6 90-minute cycles at night because you're waking up sweating your balls off, because you're dreaming too vividly because your dopamine is too high, because your cortisol level goes crazy too early and wakes you up, and you're up at like 3 o'clock in the morning.
Cortisol goes up or down?
Cortisol is down at the beginning of sleep because cortisol is, you're running from the tiger, right? So you don't want that at the beginning of the night. You want to shut it down. So your dopamine or your cortisol is supposed to be really low. Then it's supposed to surge around sunrise-ish because it's getting you ready for the day. It's awakening you, and you're like, okay, now we're ready to run from the tiger. But because of chronic stress, because of running too hard, too fast all the time, you're not cycling the way you're supposed to. And so cortisol might spike at 1 o'clock in the morning, and now you can't sleep. Or you run out of estrogen really hard, and all of a sudden you have a massive hot flash and you soak the bed. And so now you're hot, but you're cold, and your sheets need to be changed. And oh my God, and who can go to sleep after that? And so as you're interrupting those sleep cycles, your executive assistant is not doing their job upstairs. The skills that you learned didn't get honed. The experiences you had didn't get filed. The new stuff that you learned didn't sink in. And so then you feel like, oh my God, what did I just do the day before? It's all gone. And you're having brain fog and concentration problems during the day because you didn't sleep. And this cycle goes on for a decade.
Damn.
Yeah. And it's exhausting. It's absolutely exhausting. So all of those things, it's so multifactorial, right? Like, if you weren't flashing, if you didn't have the cortisol from your profession and the kids and the parents and the husband and like all of that stuff, then you'd be able to sleep better. You wouldn't be so irritable. So you wouldn't be irritable towards yourself. Like, if we're saying things on the outside that are bitchy, can you imagine what the self-talk is on the inside? Like, you're just being a complete asshole to yourself. And it just a little bit leaks out to the people around you.
What does that look like though?
Oh, just like
Self-doubt or
no confidence. Like my belly has never looked like this. Like, why is my ass all of a sudden flat? I'm like out of breath. I can't do the things. I wish that I would exercise every day, but instead I just like sit on the couch and doom scroll. Like you're mean to yourself in your head a lot. And honestly, like therapy helps a lot with redirecting that in itself to just stop that negative chatter of like all the bad experiences in your life, like all day long. And so, yeah, when we get snippy and sassy and snarky with other people, that's just like a tiny percentage of what's actually going on in here towards ourselves.
At what age did you say, oh shit, I got this? At what age did you say, I'm going through menopause?
8 years after I started it.
Shit.
8 years. I ignored my own symptoms.
What do you think was going on?
This is just what happens when you get old. Yeah, I'm having a bad day. My job is super shitty. I'm in a really weird relationship. My kid's in middle school. My parents just moved up here and it's really heavy. There was always some excuse as to why I was feeling the way I was feeling. And I'd already had insomnia for a really long time. So that wasn't particularly a good flag to fly. But yeah, it was just symptoms getting worse and worse and worse. Couldn't lose weight. Yeah, it just kept going and going. And then finally, one of my friends who's younger than me was like, oh, I went and got my hormones checked because I thought I might be in perimenopause. And I was, and I got on hormones and I feel super great. And I made my husband go in because he can't keep up anymore. And he's 9 years younger than me. And I was like, I wonder if I should go get my hormones checked, because I had gone to my gynecologist at one point and said, I think I might be in perimenopause. He's like, you're probably too young. And he got one lab, one FSH, totally random. It's supposed to be timed. And said, nope, it's normal. Well, normal is anywhere between like 25 and 500, depending on where in your cycle it is. So that wasn't a great test. And he didn't check estrogen, testosterone, progesterone, LH, DHEA, like none of the things that you're supposed to check now.
What's the common age for women though? Like usually or when they start to see it?
I would say mid 30s, you can start kind of feeling things.
Mid 30s.
Some people do. So it's anywhere between 8 and 12 years. Most people are in menopause in their early 50s, but some people start running out of hormones in their mid 30s. You should be really checking on things in your early 40s though. And the other thing is, even if your labs are normal, but you are having symptoms, you should treat those symptoms. That's the new science that is coming out, is that you don't wait for all the periods to stop. You don't wait for all of the hormones to run out, because by the time you've done that, you've missed out on years of preserving your bones, preserving your cardiovascular health, making your life better. Like, why would you suffer through 8 years of your symptoms just because your labs don't reflect how you feel?
How do you get the treatment without a diagnosis though?
The diagnosis is symptomatic. So that's the big difference, is we don't wait for your estrogen to run out. Like, if you are 42 and your estrogen is normal and you tell me like, I am snapping at my children, I can't sleep, I'm having hot flashes, I am dumber than I've ever been in my entire life, I'm going to say, let's get you on some estrogen right now.
Okay.
Right now. And so it's a very different thinking. Here's what I would say though. Historically, like generations before my generation of physicians, they were giving people hormones all the time, left and right. Oh, are you having symptoms? Here, have some. And that was just normal. And then they did this stupid women's health initiative and told everybody that the research showed that physicians were killing people with breast cancer and clots and strokes because of horse related hormones in older women. Like, they were not doing perimenopausal and newly menopausal women with bioidentical hormones. That's not what was happening. And so the research was completely flawed. It scared the shit out of everybody for like 20 years. Oh, you can't give women hormones at all. You're going to kill them and they're going to sue you. And those are all the bad things in medicine. And it turns out that research was completely and utterly flawed. And now we're having to undo all of that training and all of that teaching and get back to, no, we have bioidentical hormones. Give them to people so that they have a better quality of life now and in the future.
Can you give me some of the actual, like, hormones? Like, you get pellets. Are there pills? Are there injections?
So it's kind of interesting. So there's a lot of medications that you can't take by mouth because your stomach acid destroys them. So for testosterone, for instance, that's one of them. It really takes a hit if you take it orally. And so if you inject it, you miss the stomach acid, right? Or if you put it through your skin, it's a lot more effective. You can take testosterone orally, but it's at very, very high doses so that some of it actually makes it through the gastric phase and gets into your system. And so that is an option. Most insurances are not paying for it. So it's mostly the people who are needle phobic, who just can't stomach doing an injection, and so they take the pills, but it's expensive. So that's testosterone, and men and women can take injections and do the creams or the gels.
What's the injection, once a week?
Yes, usually once a week.
Okay.
If you're trans, it can be a little bit different. Sometimes you have to do it bi-weekly.
And men, listen, TRT will change your life. TRT will change your life. You will be in a whole nother way.
Yours and the people around you. It'll change your life and those around you.
Absolutely.
Yeah.
Truly.
Yes.
Yeah.
And I feel the same way about treating AFAB, honestly. So
Treating what?
AFAB, assigned female at birth, so women or trans men. So estrogen, you can do injections, you can do pills, you can do patches, and you can do topicals. And so lots of different options for that. And people choose different routes based on whatever they want to achieve and what they're comfortable with. Some people don't do well with the patches because they slide off if they're like, working out all the time and they're super sweaty, or they don't like the adhesive. Some people don't like the gels or the creams because it rubs off or they feel greasy. Some people don't like.
When do they rub it?
So you're supposed to put it into a large surface area with a lot of blood vessels. So usually on the inside of your arm, because you've got a bunch of blood vessels in there, or your inner thigh. If you need a smaller dose, then you can actually apply a smaller dose, a different concentration to your labia itself. And that helps with vaginal atrophy, as we were talking about last time.
Wait. You put it on your labia?
Yeah.
You put what, the gel?
Yeah, estrogen.
So you just rubbing one out? Or what?
I mean, I guess if you want to take it there, you certainly can. You are supposed to rub it in for like 2 minutes. So like if it gets you there in 2 minutes, girl, get it. Mm-hmm.
What does that feel like, I wonder? Tingly sensation or what?
Shouldn't.
My mind's going down a rabbit hole right now.
Go ahead. That's a fun one.
All right.
Okay. And actually, they're trans men who are trying to enlarge basically the remnant of their clitoris or things like that. You can use topical testosterone to enlarge those portions of your body as well.
Whoa. Trans men. That's transitioning from a woman to a man?
Yeah.
So would the clitoris get bigger?
Yeah.
Whoa.
A lot bigger.
Whoa.
Yeah, because if you so all of that is erectile tissue. All of like your clitoris, when you're aroused, gets hard and gets bigger, right? And so just like the penis for erections, the clitoris gets larger too. And some of that is testosterone. And so you can use topical testosterone as like a topical enlarger, essentially, to bring more, oh my God, this thing is going to drive me crazy.
We'll be all right.
And so, yeah, you can use things topically as well. So when you give estrogen cream to someone with a vulva and they apply it to their labia, it's at a much lower concentration. So you're not really getting the systemic mood enhancing, bone enhancing, cardiovascular enhancing, those types of benefits from topical estrogen on your labia. But you get the local effects if you have vaginal atrophy, where it makes it really painful to have sex. It can be really, really helpful for that. Or if you're getting a lot of urinary tract infections, you kind of buff up that tissue down there, make it juicier, your sphincter works better, and it keeps the bugs out.
What?
Yep.
Fucking bugs. What bugs are we talking about here?
Usually E. coli, Klebsiella, things like that, things that give you urinary tract infections.
Oh my goodness. I want to get back to the clitoris getting big.
Of course you want to go back to that.
I just gotta know. I just gotta know. Like,
yeah.
How big does it get?
I mean, basically, if you have a clitoris and you're doing a lot of testosterone, and you might be using like plumpers and pumps, like vacuum pumps, you can have like a micro penis.
Okay.
You might even be able to penetrate people with it.
Okay.
And people feel really good about that.
I had so many questions before you threw that in there. I just got totally off track. Are there any natural remedies for menopause? Anything that's natural that works well for people who don't want to put a whole bunch of different hormones in their body?
I think the problem with that is I am Western medicine trained. So I haven't really gotten into that. And there's just not nearly as much science about that. I would not ever say that there's not, because there are plenty of other cultures that believe strongly in more natural remedies. I'm just not familiar with them. I do have to say, though, that bioidentical hormones are literally just your own hormones. Like, it doesn't get much more natural than that. You know, unlike a lot of the other stuff that we use in Western medicine that's not natural per se, these aren't made with other species. Like, we get a lot of stuff from pigs and horses. It's not from that. It's literally just making our own hormones in a lab.
Now, does insurance cover most of these things, or no? How does that work as far as insurance wise? Insurance
is a bitch. I'm just going to say that. All y'all. So getting testosterone for people who are not cis males can be a problem. However, I collaborate with a compounding pharmacy, and they are happy to provide my patients with whatever I feel is necessary. And so I can get women testosterone. I can get men estrogen and progesterone if they are transitioning to be a female.
But insurance won't cover it.
Sometimes they will and sometimes they won't.
And what do you have to do to make them cover it?
Sometimes
is that between you and the patient to get it?
No, of course not. I have to fight with the insurance company, and you can imagine what an entire snafu that is. And so the way around that is doing the compounding pharmacy, which tends to be a lot cheaper than it would be just paying cash at like your CVS or Walgreens or whatnot. And they ship it directly to your doorstep. So Dr. Cari,
is it expensive?
You know what? The injectables are not particularly that expensive. And so that's really helpful.
Injectable tests or estrogen or equal?
Estrogen and testosterone are pretty cheap if you buy them by the vial and do injections.
Hit yourself?
Yeah.
Okay.
Exactly. And then progesterone is actually fairly cheap, and it's just basically a pill per night that you take. And so it's not fun though, and it should be a lot easier for people.
Why you say it's not fun? It's a shot and a pill.
No, I mean it's not fun to argue with the healthcare system to try to get what you need. It's just not. The patient typically knows what they need and knows what they want. And if I, as the physician, say, yeah, I agree with you, we should do that, it should be smooth sailing. But insurance doesn't want to pay for it, so they push back on almost everything. It's my nemesis.
As far as sex life on menopause, are you aroused? Are you not want to be touched? Or sometimes you do? You get in the middle of it, then you don't? Like, how does it work? Are you just all over the place? Look at this thing. This thing is driving us crazy.
I know.
Man.
Speaking of, can you come back over here?
We have menopause.
It has menopause.
The camera has menopause for
I know.
real. Okay.
Oh, look at that.
I listen to you. Very good.
There we go. A little bit. I think just like everything, it's very individual, right? Libido tends to flag, tends to go down with menopause for a lot of the reasons that I said. Like, you're moody, you're irritable, you don't feel cute because your body looks super weird to you, you're not sleeping, you're kind of pissing off the people around you that you might want to fuck. Like, there's a lot of different things to be happening there. Some people, however, really like and need the dopamine hit that comes from desire and sexual appetite and connecting with people sexually. That's very temporary. Like, dopamine does not last, but it can make you feel pretty good, like, in the meantime. And so some people get a little hypersexual because they want, nothing else feels good.
Oh, shit.
And so people can get kind of, I would say hypersexual.
What does it come down like after you get what you need? How tough is that life after that? After you've been to the height of the height, and then now, all right, I'm back to where I'm at, and shit still don't feel fucking great right now. How do you handle that shit? I just bust the best nut of my life, and I'm back down to rock bottom again. Yeah,
So I was just talking to some friends. I swear our phones are listening to us all the time. I was just talking to some friends about cuddling, because I think last time I was talking about getting cuddle buddies, that I was kind of backing away from being super sexual with people, and that I'm cuddling with people, and how that has been so well received. And the fact that, like, one person that I proposed this to,
man or woman?
Men. One person that I proposed this to, and I was kind of waiting for him to not be super excited about me saying that. And he was like, yeah, me too. I need that really bad, like way more than anything else. And I was like, that is super fascinating. And I'm so glad that I brought it up and that I could be vulnerable enough to say, this is what I need. That he was like, oh my God, me too, really badly. And so then, of course, my phone sends me this thing that Trevor Noah had to say about men and intimacy, and how men tend to be more sexually motivated, but it may not be sex that they're needing. It may be intimacy and companionship, and sex is the only way that they get that, because they don't express this vulnerability of, I just need to be held. Like, because it seems like a weakness. I feel like it, even I feel weak saying I need cuddle buddies and I need somebody to just like hold me and rub me and spoon me for a little while to try to make me feel better. And I think men are conditioned to not do that pretty much ever. I mean, you grow up and you're pretty like solitary, or like, this is a team and we're all bros, and like, you're not going to say, yo dog, I just need to be held. That is not going to happen.
I don't think I'm going to ask Jeffrey to hold me.
I don't think Jeffrey's going to hold you if you ask him.
No, he won't. No.
I don't know. Maybe he would. Like, it depends. If you were tender about it, he probably wouldn't. If you were,
I give Jeffrey hugs.
Yeah.
I give Jeffrey hugs.
Okay. No, come back over here.
Can you get it to go back over there?
I don't know. I don't know why it's tracking.
Look at this. Got on some crazy setting. We're just doing new shit. We got new equipment. We don't know what the hell we doing in here. This is Dr. Cari for fuckface. Tune into her telehealth. I still want to stick with this sexual menopause and sexual health. What is it like right now? Once your hormones get balanced out and the whole nine, are you just like ready to go? Because your friend said, hey, I got checked out and I was ready to I'm back in the game.
So the hormones aren't going to get like, you're not going to all of a sudden at the age of 54, you go on hormones and you're like, I'm 32. That's not what's happening, but you're definitely better than you were before you started the hormones. Let's just put it that way, right? Like you're taking several steps in the right direction. As far as physically feeling better, your mental health improves, your sleep improves, probably your interactions with other people improve. And so part of that is also going to be your sexual appetite. Like if you're sleeping better and you have more energy, then you might want to get laid. And so I think that's a big part of it. There's lots of things that break. And so then there's lots of things to fix for you to get back on the horse of wanting to be sexually intimate with people. And I think some of that goes back to the fact that women at that age are completely overwhelmed with life. Like if you have a career, you're probably at the top of it. And so the pressures are really hot, really strong. Like you know, and you're looking at, okay, how do I retire in 10 to 12 years, right? So you got to be thinking of that. You got these damn kids around. Your parents are, if they're still around, they're probably not doing so great. You might have been with a partner for a long time and it might be stale and dusty and ready. And like, you're just looking at him like, I need you to take the garbage out before I hit you over the head with a frying pan. Wow. So yeah, so it's a lot. And if that's what you're dealing with for 12, 14, 16 hours a day, who the hell wants to then have the energy to engage sexually? Like, I just want to try and get some sleep before my hormones wake me up, before the next hot flash, before my next cortisol surge, right? And so I believe strongly that one of the best things that male partners can do, or female partners who aren't going through menopause at the same time, is to be more helpful, to give space when it's asked for, to get close when that's asked for. Because the support is real, like doing some extra chores, helping out, doing more things so that the person who's suffering through this chemical castration can get a few deep breaths. It is a chemical castration.
Of a woman.
Of a woman. Yeah. So they do so you do see chemical castrations, especially for pedophiles, basically to make sure that they don't make testosterone and they don't have that physical drive. And frankly, it dries up your genitals. So you don't feel really good about your penis anymore. But that is what's happening as we age.
Who the fuck is doing this?
The penal system.
They're giving them what?
They can give you medication so that your testosterone.
That part of the room.
I can't even stand it. Yeah. I mean, it is a beautiful day outside.
Oh, chemical castration, fellas, be careful. Gonna give us pills or what? Do we get pills? How do they do a chemical castration for a man?
It is a series of shots.
Oh my God. If you stop taking the shots, will you go back up? You go back up or what?
I think that once your testicles are told to not do their jobs, after a while, they don't.
Damn.
I mean, it's just like if...
Don't be playing with them kids out there.
Not ever.
Them kids alone.
Bastards. So, I mean, if we were able to turn on and off gonads like that, then during menopause, we would just give women a shot to be like, hey, ovaries, you still need to do your jobs. And so it's the same. Like once you turn off gonadal tissue enough.
Did you say gonadal?
Gonadal. You love that word so much. I am never going to stop saying
it. You keep playing with that word. You keep extending it in different directions. It's cool.
Uh-huh.
All right.
Well, if you ask about sex, I'm going to talk about gonads.
10-4.
Mm-hmm.
You think you busted bigger nuts in your later years or in your younger years?
Do I bust a nut?
I'm asking you.
I don't have nuts.
The biggest orgasms you had in your younger or later years?
Oh, later. I think by the time I was 25, I was still wondering if I had ever had an orgasm.
Wow.
Yeah. And I mean, it's not just because my partners didn't know what they were doing. I didn't know what I was doing. And it takes so much focus and concentration for women to have an orgasm that you don't know how to do that when you're concentrating on like, how do I look? And, do I have a fat roll? And oh my God, he's touching me here and I don't like that. And you're all in your head about stupid things.
Yeah, you way too in your head. The motherfucker's already in your bed with a hard penis. I think you won the bet already.
No.
I'm
telling you right now, most people, like, you weren't. Well, no, you weren't, because you.
Listen, I'm a child of R&B. Okay, I am a child of R&B. I grew up around Genuine.
You're a child of Mrs. Robinson, is what you are.
This is true.
That's what happened.
Yeah, but at the same time, like I can create hell of an ambiance as well. So later in your later years, huh?
Oh yeah, by far, absolutely.
Wow.
I think it's easier to concentrate, and now you have some confidence in yourself.
I was going to ask that. Do you feel more comfortable about who you are as a human being? Do you know see the path, huh?
Yeah, I think it's self-comfortability and confidence. I think it's the experience of how do I relax into this and focus on that pleasure. That being said, the flip side of that and being older is that life is more stressful. You've got more on your plate. And so it's harder to be present and let everything go so that you can get to that plateau.
You have better orgasms by yourself or with others?
Ooh, really?
I'm asking. Fuck's sake.
For fuck's sake. For sure. Okay. Well, I would say personally, my best orgasms are with another person with toys. Can I say that? It's like a hybrid answer.
Definitely a cheat code.
Well, I mean, the best orgasms that I can have involve like clitoral stimulation as well as stretching out of the clitoral tissue around the vagina. And so like having penetration enhances that. So they're like women more often than not, I think like over 80% of women need clitoral stimulation to have an orgasm. And I get that. Absolutely. Very, very small percentage can have it from just internal penetration. But if you get both at the same time, amazing. And so that's why, guys, vibrators are your friend. They are teammates, not competition. You cannot possibly do what a vibrator does, and we are not expecting you to do what a vibrator does. But we are expecting you to be okay with grabbing one off the bed nights and like giving it to us. Yes, please. And whether you want to drive or you give it to us to drive is totally fine. Yes, but we want you there. That makes things even better.
They want you there with a second partner in there. What the fuck they want? They want you in there with a second partner. Okay, this is more about her than it is us.
You asked me the question.
I'm just telling you I'm interpreting here.
Okay, so is your nut busted better with your partner or with toys or by yourself?
Well, with my wife, of course. There's a whole situation there. There's a whole lot of woman right there. Yeah. But Yes. You have it all. Your feelings,
Yes.
all that shit.
Kissing and warm flesh and all of that.
All of that shit is there. That's very important, I think. I think that, and then it's a lot longer too when you
that's for sure.
With your partner. When you by yourself, it's notes.
Oh, is that it?
Probably not even a minute and a half before you
You are efficient.
Yeah, for sure.
Yeah.
Like, you're not trying to hang around in there long because it still kind of feel kind of awkward and weird that you have to fucking do this. You know what I mean? Like, yeah.
No, I agree. That's why, like, toys, 100% I'm going to get off. Yes. Just like you guys jerking off. It's going to happen. But it doesn't feel as good. So it's much better with another human being. But if you can add a toy in there, amen.
All right. So we wanted to go through some mental health, sleep, sex as far as menopause goes. We've given you all of that tonight and more. Anything else, Dr. Cari?
If you have more questions, come to my telehealth, drcarifffs.com. I'm doing hormones for all genders. I'm doing care coordination. You can come talk to me for counseling, you and your partner, if you want to start with me. I also collaborate with a bunch of different practitioners throughout the United States, actually. And so if I feel like, we take it to a certain point and you need a referral to someone else, I will find you the right person.
Joseph.
And get you some toys for your woman. That's right. And frankly, vibrators feel really good on men too. Like, don't forget yourselves.
Where?
Wherever you want it.
And
some people like it on their taint. Some people like it on their balls. Some people like it very gently on the glands, on the very tip of their penis, along the shaft.
What glands?
The glands is the head, your knob.
Okay.
And so don't forget, get a toy for yourself and keep it nice and clean. And that way, when your partner comes over, you can share it with them too.
All right. This is Dr. Cari, for fuck's sakes. I want to thank you guys for hanging out with us tonight. And, fuck.
You love it when I talk about gonads. And he's the one who wanted to talk about sexual health. It's not just me all the time, even though I'm always on board to talk about it.
First of all, me and Jeffrey produce the show, and I have to keep it in the same vein of what the show is, because either way, we're going to go sexual health somewhere. We could be talking about fucking Fruit Loops, and she's going to find a fucking way to throw an orgasm or a toy or something sexual in there.
Fruit Loops are holes.
Yeah, keep those dildos out your butts, fellas.
Or don't.
Keep them out your butts.
Just make sure it is attached to a human or a leash, or it has a flange. Because nobody likes going fishing for that. And you were not out in the garage naked, falling on things.
You don't know what a flange is, but it's okay, for fuck's sakes. We love you guys. Tune in next time.
Trying at the same shit. Kinda tight, tryna give a fuck. Saving grace has never hit the same end. I've been running out of luck, yeah. Said I've been running out of luck, yeah. Said I've been running out of luck, yeah. Said I've been running out of luck, yeah. Kinda tired, trying at the same shit.